All right, get ready, because today we're diving deep into something you probably haven't heard of.
Yeah, most people haven't.
It's called enameloplasty.
And honestly, it's not exactly a common topic.
Not something you chat about over dinner, right?
Right.
But it's surprisingly common.
Much more than people think.
Way more than you'd think.
Yeah.
Imagine reshaping your teeth.
Like molding Claire.
But instead of an art studio, you're at the dentist.
Exactly.
That's basically enameloplasty.
In a nutshell.
And the reasons people get it done.
And the pros and cons.
Yeah, they might surprise you.
They really might.
So before we get into the details,
Yeah.
let's back up for a sec.
Of course.
For those of us who are totally clueless.
Okay.
What exactly is enameloplasty?
Well, enameloplasty is a procedure where a dentist very carefully removes a tiny amount of enamel from your teeth.
And enamel is?
Enamel is that hard outer layer of your teeth.
The protective layer.
Right. It protects your teeth.
So it's kind of like sanding down a rough edge on a piece of wood.
Exactly. That's a great analogy.
Okay, so it's about smoothing and reshaping the tooth's surface.
Yes.
We mentioned the cosmetic side.
Right.
And it's true.
It is.
Enameloplasty is often used to improve how teeth look.
For sure.
Like fixing little chips or smoothing out uneven edges, or even making small changes to a tooth's shape.
Yeah, but here's where it gets interesting.
Okay.
Enameloplasty can also be super important for preparing a tooth for other dental work.
You mean like getting a crown or a veneer?
Exactly. Sometimes a tooth needs a little adjustment to make sure a crown or veneer fits perfectly.
Oh, I see.
Enameloplasty can smooth out bumps or irregularities.
To make a perfect surface for the crown?
Yes, for the restoration.
Wow, I never thought of it that way. So it's not just about looks, it's about function, too.
Absolutely.
And it can even help with bite issues.
Yes, if a tooth is slightly out of alignment,
Causing bite problems?
enameloplasty might be able to fix that.
By making small adjustments to improve how the teeth fit together.
That's right.
Okay, this is fascinating. So if someone has a chipped tooth, some minor misalignment, or is getting a crown, enameloplasty could be an option.
Exactly. It can also help with a condition called enamel hypoplasia.
Enamel what now?
Enamel hypoplasia, it's a developmental defect where the enamel on the teeth doesn't form, right?
I see.
This can cause pits or grooves or discoloration on the teeth, and enameloplasty can smooth those out.
So it improves the appearance of the teeth?
Yes.
Wow, I've never even heard of that. So for someone with that condition,
Right.
enameloplasty could be life-changing.
It can be very effective, yes.
Now, the word enameloplasty,
Yeah.
it sounds a bit intimidating.
I know.
Like I'm picturing grills and needles.
Oh, no, no.
But not at all.
Okay, good. It's much simpler than that.
Phew, because that was not the image I had in mind.
You can relax. The procedure is usually very quick.
Quick. Like how quick?
Often less than 10 minutes.
Wow.
And here's the best part.
What's that?
It's generally painless.
Painless.
There are no nerve endings in the enamel, so you usually don't need any anesthesia.
Wait a minute.
Yeah.
Less than 10 minutes and no pain.
That's right.
That sounds almost too good to be true.
It's a relatively simple and straightforward procedure.
Okay, but I'm guessing every case is different.
Of course.
And there are risks.
There are always potential risks and considerations.
Which we'll definitely discuss.
Low.
But in terms of the procedure itself,
Yes.
it's usually pretty quick and comfortable.
It is.
Okay, that definitely eases my mind a bit. What about recovery?
Okay.
Is there any downtime?
Not usually.
Can you eat normally afterwards?
You can resume eating and drinking almost immediately.
Wow.
You might have some temporary sensitivity to hot or cold,
I see.
but that usually goes away within a few days.
So maybe skip the ice cream right after the appointment.
Probably a good idea.
Good advice. So overall, you can pretty much go about your normal routine.
Yes.
Okay.
But here's something important.
Right.
Enamel doesn't grow back,
Oh, right.
unlike other tissues in your body.
I see.
So any changes made during enameloplasty, they're permanent.
So no takebacks.
No takebacks.
Definitely something to consider carefully.
Is.
But it makes sense.
Yeah,
Enamel's pretty precious.
it is.
And that brings us to a key point.
Oh, right.
The potential risks of enameloplasty.
Yeah, it's important to understand those.
Okay.
Because while it can be a very effective procedure,
Right.
removing too much enamel can have downsides.
Okay, let's talk about that. What are some things that can go wrong?
Well, one of the most common issues is increased sensitivity.
Makes sense.
Remember, enamel protects the inner part of your tooth.
Called dentin.
Yes, dentin.
And dentin is more sensitive than enamel, right?
Exactly, much more sensitive.
Okay.
So if too much enamel is removed,
Oh.
you might find your teeth become more sensitive to hot or cold foods.
Ouch. Yeah, I can imagine.
And briefs.
So it's about finding a balance.
It is.
Enough enamel removed to get the result you want,
Right.
but not so much that you end up with sensitive teeth.
Precisely. And there's another potential issue.
What's that?
The color of your teeth, the
Okay.
dentin, that inner layer,
Yes.
it's actually more yellow than enamel.
So if too much enamel is removed,
The dentin can start to show through.
making your teeth look more yellow.
Yes.
That's not ideal. So it sounds like finding a skilled and experienced dentist is really important.
Absolutely. You want someone who really understands enamel.
And knows how to remove the right amount
Exactly.
without damaging the teeth.
Right.
That's more complex than I thought.
It is.
And we haven't even talked about costs and insurance.
You're right.
There's a lot to consider.
There is.
And I bet the cost of enameloplasty can vary.
It can, depending on the complexity of the procedure.
The dentist's experience,
Uh-huh.
and even your location.
That's right.
I bet insurance coverage could be tricky too, right?
You're right on track.
Okay.
Most dental insurance plans don't cover purely cosmetic procedures.
I see.
However, if the enameloplasty is for functional reasons,
Like,
correcting a bite problem or preparing for a crown,
okay.
there's a chance your insurance might cover part of it.
So it's definitely worth checking with your insurance company before doing anything.
Absolutely.
All right, we've covered a lot.
You have.
What enameloplasty is,
Right.
reasons to get it done,
Uh-huh.
the procedure itself,
Yeah.
potential risks, and cost considerations.
Yes.
I feel like we're just scratching the surface here.
You're right. There's a lot more to explore.
Like how to make sure you're a good candidate for this.
And finding the right dentist.
Exactly. Well, luckily,
Yeah.
we have plenty of time to go deeper into those topics.
You.
But before we do that,
Okay.
let's take a quick pause.
That's good.
We'll be right back to continue our deep dive into the fascinating world of enameloplasty.
I'll be here.
Welcome back, everyone. I don't know about you, but I'm already feeling a lot more informed about enameloplasty.
Yeah.
Before the break, we were talking about how enamel doesn't grow back
Right.
and how taking off too much can cause problems,
Yeah.
like sensitivity and even cracks.
Uh-huh.
Let's talk more about those risks.
Okay, it's important to understand why those risks exist.
Yeah.
Remember how we talked about enamel being like the protective shell of your tooth?
Yeah, like armor.
Exactly. Well, when that shell gets too thin, the inner layer,
The dentin.
yes, the dentin, it gets exposed.
And dentin is more porous and sensitive than enamel, right?
Exactly.
More vulnerable.
Much more sensitive.
So imagine
Okay.
you're enjoying an ice cold glass of iced tea.
Right.
And if your enamel is thin,
Yeah.
that cold just hits the dentin.
And goes right to the nerves inside your tooth,
Ouch, yeah.
causing that sensitivity?
Okay, that explains sensitivity. But how does removing enamel make a tooth more prone to cracks?
Well, think of it this way.
Okay.
Enamel gives your tooth strength.
Like the foundation.
It's the structure.
Okay.
When you chip away at that, the tooth becomes weaker,
More fragile.
more vulnerable.
So biting down on something hard,
Uh-huh.
like ice,
Or hard candy.
could actually cause the tooth to crack?
Yes, to fracture.
Wow,
You-
okay.
yeah,
I'm definitely starting to see why it's so important to find a dentist who really knows what they're doing.
I agree. You want someone who's experienced,
Knows the balance
who understands that balance
between the look and the health of the tooth.
between achieving the desired result
Yeah.
and preserving the integrity of your teeth.
So what kind of questions should we ask a dentist during a consultation for enameloplasty?
First of all, ask about their experience.
Like-
how many enameloplasty procedures have they done?
Okay.
What kind of results have they seen?
Uh-huh.
Have they ever had any cases where complications came up?
Yeah, that's a good one.
And how did they handle those?
It's our right as patients to know,
It is.
to be informed
Yes, to feel comfortable.
with the person we're trusting with our teeth.
Exactly.
What else should we be asking?
You can ask to see before and after photos of their patients.
Well, that's a good idea.
It'll give you an idea of their work.
Yeah, if their aesthetic matches what you're looking for
Exactly. And of course, discuss your specific goals.
for the procedure.
Yes, what you're hoping to achieve.
So it's a two-way street.
It is.
We need to be open with the dentist
And they need to be realistic with you.
about what's possible.
Exactly. And don't hesitate to ask about other options.
Because enameloplasty isn't always the answer.
It isn't. There might be other treatments that are better
Right.
for your specific situation.
You mentioned earlier that enameloplasty is sometimes used with orthodontic treatment.
Yes.
Can you tell me more about that?
Okay, so braces
Mm-hmm.
or clear aligners,
Uh-huh.
they're great for big misalignments.
Right.
But sometimes
Even after you're done with braces.
there might be small imperfections
Yeah.
that bother you.
Okay.
Maybe a tooth is a little too long.
Or has a small chip.
That wasn't fixed during the orthodontic treatment.
So enameloplasty can be like the finishing touch.
Exactly. It's the fine-tuning after braces.
And it can also be used to help a crown or veneer fit better.
Yes, sometimes a tooth has a bump.
Or an uneven edge.
That prevents the crown from sitting properly.
Oh, I see.
Enameloplasty can smooth those out.
Okay, I'm really starting to see how versatile this procedure is. But how do I know if it's right for me?
That's the big question.
Yeah.
And unfortunately, there's no easy answer.
What makes someone a good candidate?
Well, the best thing to do
Okay.
is to schedule a consultation
With a dentist?
with a qualified dentist who has experience.
With enameloplasty?
Yes, they can examine your teeth
Listen to your concerns.
and determine if enameloplasty is a good option.
So it comes down to finding a dentist you trust.
Yeah.
Having an open and honest conversation
Absolutely.
about your goals.
And expectations.
And it's always a good idea to get a second opinion.
It is if you have any doubts.
Right, this is your smile.
It's worth taking the time to make the right decision.
We've been talking a lot about the risks of enameloplasty.
We have. It's important to understand those.
But let's not forget the positives.
You're right.
There's a reason this procedure is popular.
There is.
Yet done correctly.
By a skilled dentist.
Enameloplasty can make a big difference in how your smile looks.
It can smooth out those little imperfections.
That bother you.
Yes, giving you confidence.
Helping you feel your best.
Absolutely.
And it's a relatively quick and painless procedure.
It is.
With minimal downtime.
Yes, but again, finding a qualified dentist is key.
Do your research.
Have a thorough discussion.
About your expectations.
And any potential risks.
Okay, we've covered a lot today.
We have.
The ins and outs of enameloplasty.
Uh-huh.
The benefits and the risks.
Yes.
I think we've given our listeners a lot to think about.
Definitely.
Before we wrap up,
All right.
we want to leave you with one final thought.
Okay.
Knowing what you now know about enameloplasty,
Yeah.
how might you approach a dental issue differently?
Hmm.
Would you consider this procedure?
That's a good question
What questions would you ask your dentist?
to make the most informed decision.
For your unique situation.
Those are excellent questions to reflect on.
This deep dive is just a starting point.
It is.
It's your smile.
Your journey.
We're here to give you the knowledge to make wise choices. Welcome back to the deep dive. We've been talking all about enameloplasty.
It's a fascinating procedure.
The good, the bad, the things you need to know before you even think about getting it.
Right.
Speaking of getting it,
Yeah.
there's one big question we haven't talked about.
Okay.
How do you find the right dentist for this?
That's so important.
It is.
You wouldn't trust just anyone to do surgery.
Right, like brain surgery.
Exactly.
You want the best.
The most qualified.
Well, your teeth are just as important.
They are.
Enameloplasty is a serious procedure.
It is.
It requires skill.
Precision.
Yeah, and a real understanding of teeth.
Of dental anatomy.
Okay, so where do we even begin looking for a qualified dentist for this?
It's not like they have billboards or anything.
Right.
It's not that easy.
But luckily, there are resources
Oh, yeah.
to help you find the right dentist.
Absolutely.
First,
Okay.
ask around.
Talk to people.
Talk to your friends, family.
Doctor.
Maybe they've had a good experience with a cosmetic dentist.
Exactly. Word of mouth is powerful.
It's like a built-in recommendation system.
From people you already trust.
And don't forget about online research.
That's a great resource, too.
Websites like the American Academy of Cosmetic Dentistry,
Uh-huh.
they can help you find dentists in your area.
Who specialize in these procedures.
What about online reviews? Are those worth looking at?
They can be helpful.
But be
careful.
Yeah, take them with a grain of salt.
Online reviews can be subjective.
People are more likely to leave a review if they had a bad experience.
That's true.
Right.
Look for patterns in the reviews.
Like,
Do you see multiple people saying good things about the dentist?
okay, so we've narrowed down our list
All right.
using recommendations, online research, maybe even some reviews.
Mm-hmm.
What's the next step?
Schedule a consultation.
With the dentist.
Yes. Meet them face to face.
Get a feel for their personality.
Their approach.
Yeah, and ask questions.
Ask all the questions you have.
It's like a first date for your teeth.
I love that analogy.
You want to make sure it's a good fit.
Before you commit to anything,
Pay attention to their communication style.
do they listen to you?
Do they explain things clearly?
Do they seem rushed?
Those are red flags.
Definitely.
Let's talk specifics. What should we be asking about enameloplasty during the consultation?
Don't be afraid to get into the details.
Like what?
Ask about their experience.
With enameloplasty?
Yes, how many procedures have they done?
Okay.
What are their usual results?
Have they had any complications?
And how did they deal with those?
Those are good questions.
To assess their expertise,
What else?
ask to see before and after photos.
Of their patients?
Yes, that'll give you a visual idea of their work.
If their style matches yours?
You want to be on the same page about what looks good.
What looks natural?
Exactly.
It's important to discuss the risks and benefits too, right?
Absolutely.
If they relate to my specific case.
Each patient is different.
Yeah, what works for one person might not work for another.
Exactly.
Be open and honest with the dentist.
Tell them about your concerns.
Your expectations.
Any previous dental work you've had.
It's all about communication.
It is.
And of course, we need to talk about the practical stuff.
The money.
The cost.
The insurance.
Don't be afraid to ask about the price.
Up front.
And if your insurance covers it,
Some dentists offer payment plans.
or financing.
So ask about those too.
If you're worried about the cost.
Even if enameloplasty seems simple,
It's not.
this conversation has shown us
How important it is to do your research.
find a qualified dentist.
Be involved in your own dental care,
I agree. Knowledge is power.
especially when it comes to your smile.
It's worth it to make informed decisions.
A big thank you to our expert for all this information.
My pleasure.
And to our listeners.
Yes.
We hope this deep dive has given you the power to ask the right questions.
Explore an options.
And take charge of your dental health.
Your smile is important.
It's your superpower.
Until next time.
Stay curious.
Stay informed.
And keep diving deep.